What is OCD? OCD stands for Obsessive Compulsive Disorder. OCD is a chronic disorder where a person has strong, uncontrollable, recurring thoughts, also known as obsessions, and recurring behaviors, also known as compulsions. These thoughts and behaviors are repeated over and over. When a person with OCD tries to fight their compulsions or obsessions, they typically start to get stressed and anxious. So they succumb to compulsions to ease the stress. Most OCD-related issues center around one specific topic or idea, such as hand washing. It can affect many different types of people and is very common. It is present in both kids and adults alike. Most OCD is diagnosed by around the age of 19, but has even been diagnosed after 35 in many cases. This being said, it first starts to appear in two main phases. One's from ages 8 to 12 and one from the late teen years to the early adult years. OCD can cause a variety of symptoms ranging from person to person. Some common obsessions, aka recurring thoughts, include phobias, needing things to be done in a specific way, aggressive or violent thoughts about others, or unwanted thoughts about religious or sexual topics. Some common compulsions, aka recurring behaviors, include excessive cleaning or hand washing, organizing things only in a very specific ways, compulsive counting, or repeatedly checking on something. For example, checking frequently to see if the door is locked or if your shoes are tied. Something to remember is that people with OCD often have very specific symptoms because everyone experiences OCD differently. Some common signs someone may have OCD are repetitive tics such as grunting, blinking, jerking of the head, and more. The causes of OCD are not fully understood. The most widely accepted theories are that OCD is caused by genetical factors, experiences, and learned behaviors, and changes in one's chemistry. These fit in with the common risk factors of OCD, meaning that they can increase someone's chance of developing it but not directly cause it, which include family history both through genetics in nature and experiences in nurture, traumatic events, or other mental health disorders. How is OCD treated? The main objective of OCD is not to cure it, but rather to manage the symptoms so the patient can live their life without being affected too much by them. Because everyone experiences OCD differently, and some people may have more or less severe forms, treatment varies. The most common treatment options include psychotherapy, medication, or even outpatient programs like rehab centers or retreats. Psychotherapy mostly includes CBT, which is cognitive behavioral therapy, or ERP, exposure and response prevention. The latter essentially slowly helps patients get more and more comfortable with feared obsessions by being exposed to them. Most of these treatments require work from patients and are not quick fixes, but can increase the quality of life of a person with OCD. If you are a person who wants OCD treatment or think you may have it, the best way to receive medical care is to either visit your primary care physician or to see a therapist. Your physician can diagnose you and refer you to a psychiatrist or therapist, who will then help you work through your symptoms. If you know a loved one that has OCD, you can help too. If they need help but they are not seeking it, you can help them receive it. You can also offer support through educating yourself about OCD triggers, teaching relaxation techniques, and making sure they're actively participating in their routine and treatment plan. Create a safe space for those with OCD and talk to them in a gentle manner. Stay away from stereotypes and myths about it. Some common damaging myths include the myth that people with OCD are simply control freaks, or that they should just stop performing their rituals. People with OCD perform their rituals not for pleasure but to soothe their anxiety. They want to stop, but they cannot. Such damaging stereotypes can make people with OCD suffer more or feel that they are in the wrong for their disorder. In summary, OCD is a common mental disorder affecting people from all ages and all walks of life. It causes people to partake in compulsive behaviors or obsessive thoughts that they cannot control in order to soothe anxiety, which can be caused by a variety of things. The good thing about OCD is that it is easily treatable and manageable. If you know somebody with OCD, make sure to support them and help them lead happy and healthy lives. Some resources for OCD include the International OCD Foundation, which is an educational site to find treatment nearby with links to online support groups and live chats. The Anxiety and Depression Association of America, which has peer support groups, blogs, webinars, and podcasts to provide people with information and resources for OCD and other diagnoses. OCD Challenge, which is completely free, has interactive activities to help those with OCD manage their symptoms or compulsions. You can also contact the NAMI helpline at 1-800-950-NAMI or info@nami.org. You can also look to local support groups, therapists, and health professionals.